Dr. Jeffrey Lehrman. Happy Friday. WebCME wants you to start your weekend with a win. The Clinical Connection Friday feature today is plantar fasciitis. As a podiatrist, one of the most common things we see in our office is heel pain. Heel pain on the bottom of the foot, plantar heel pain. And the most common cause of that plantar heel pain is plantar fasciitis. There's a structure on the bottom of the foot called the plantar fascia. When it gets inflamed, we add itis to it, and that's where we get what may sound like a crazy term, plantar fasciitis. The plantar fascia is a structure that attaches to the bottom of the heel bone. It runs the entire length of the foot and then attaches at the front of the foot near the bases of the toes. When the fascia becomes inflamed at its attachment to the heel bone, it can be quite painful, and it leads to people often coming in to the podiatrist. What's important to know is that the cause of plantar fasciitis is normally an underlying biomechanical fault, where something is abnormal with the function of the foot. It can be a gait abnormality, it can be a limb length discrepancy, and it most often has to do with poor arch function, where somebody has a very flat arch or an abnormal flattening of their arch as they walk, and that can contribute to abnormal stress and strain on the plantar fascia and pulling of the plantar fascia on its attachment to the heel bone. And that can lead to the discomfort that people experience. The treatment for plantar fasciitis is 2 steps. The first is to address the acute symptoms of pain, and the second is to address the underlying cause. Because most of the time, if you just address the symptoms of pain and inflammation only, it will come back.
I'll be back.
So the first step is to address those acute symptoms, and we often accomplish that with an injection, which would be a local delivery of anti-inflammatory. There's also the option for oral anti-inflammatory or topical anti-inflammatory, ice, rest, physical therapy, stretching, night splint, immobilization in some cases. There are lots of things that we can do to address those acute symptoms. And then addressing the problem long term involves figuring out what the cause is and then addressing that. And if it is a biomechanical problem or an arch function problem, we can normally address that with a custom orthotic that we make from a mold of somebody's foot and getting them a device in their shoes that can control the function of their foot to control and eliminate this deforming force. Be sure to send us your questions and follow us on Facebook, Twitter, or LinkedIn. Enjoy what I hope for you will be a safe and relaxing weekend.